Good evening. This is Paul Lynch. I'm a anesthesiologist and pain management doctor from Scottsdale, Arizona. And I know many of you have been following me on my weekly videos since I went to New York City. I worked in the ICU at Bellevue Hospital when COVID was really hitting hard and the outbreak. A lot of my friends in the anesthesiology department got sick, and I went to help and started making at that time daily videos, and now I'm doing weekly videos just to continue to do education. I've been very encouraged over the last week as we have started to open the country, and at least as of now, we continue to see case rates and death rates trending in the right direction. I'd say this is the first time I've been really encouraged by the data, in the last 2 or 3 months. And it's given me a little bit of time to kind of think about what are the next steps. And I think we need to be very vigilant that just because we're trending in the right direction now doesn't mean that more cases won't emerge. And so certainly we should continue to observe social distancing, washing our hands, wearing masks, testing and tracing, contact tracing for people who are positive. We need to be doing everything we can. But it's also given me a little bit of time to start to think about what's our role going to be in the world. And when I say our, like the United States, what's our role in the world now? And so this week has been a really interesting week. I got the opportunity on Tuesday to meet with Representative Debbie Lesko's office. And yesterday I had the opportunity to speak with Representative Grijalva, both representatives to the United States Congress from Arizona. And one's a Republican and one's a Democrat, which made me really happy that I could talk kind of cross aisle about the importance of a coordinated global health response. And I got a bunch of questions because I posted, just still shots on my Facebook page and LinkedIn saying that I had the opportunity to speak, directly with some of the decision makers. And I got the same question multiple times, which was, well, what did you talk about? What did you recommend? And so I thought for this week's video, I would do a video kind of replicating what one of these meetings went like and what we recommended. And so I've asked Luke Wentz, who's a really good friend and just compassionate individual, to join me on a video tonight where I'm going to ask him some hard questions about, okay, now that we've kind of have a moment to take our breath from COVID, what should we be doing around the world? And so I'd like you guys to join us for this conversation, and then I'll finish up at the end. Okay, well, I am so privileged and thankful to be joined on my video this week by a great friend, Luke Wentz. Luke is the Western Regional Outreach Director for the U.S. Global Leadership Coalition, and we started working together several years ago as we found out we have a lot in common. Both of us really interested in causes around the world. I think Luke actually found me through some work I was doing in Africa on social media and reached out to me and asked me about the work we were doing in Africa. And we hit it off, have a friendship for the last couple of years. And Luke, I wanted to have you on tonight to get your opinions on COVID-19 and specifically how it's going to affect the rest of the world. I think we've been really focused up to this point on how it's affecting us as Americans in New York City and Arizona, but I'm starting to turn some of my attention to what's going on in the rest of the world. And I thought you were the perfect person to come on tonight and maybe give us some of your thoughts. Would you start by just telling us a little bit more about who you are, what you've been doing around the world the last 10 years?
Absolutely. Well, Dr. Lynch, thank you for your interest and invitation to join you. First off, I want to thank you for not only the work that you've done by flying to New York City and doing that, but also, and you've been very helpful to me and my organization by talking with some of our legislators this week, and I know we're doing it again next week. So grateful for all the work you're doing, not only just from your outstanding presence here in the States and what you've been able to do, not just here, but around the country. You've got so many people looking at you for your leadership right in this moment, and grateful that you've been able to provide that. On top of that, but also not just as a friend, but you're a fantastic medical doctor, and grateful for everything you've been able to do. To pivot from there, a little bit about me. Born and raised here in Arizona, ended up going to school in Lincoln, Nebraska. And I always knew I was interested in foreign policy and getting involved in kind of the intermingling between religious philosophy, reality of international relations, and politics. So I spent some time after school in Jordan, where I was working on Palestinian refugee camps, as well as going to school and doing some works right in the heart of Amman, Jordan, for the most part, and some of the Bedouin villages right outside. And then I ended up in Lebanon, where I worked, lived in Beirut, which if you're familiar, and then went over the mountains right up onto the border of Syria and worked on refugee camps there. So I've worked right in the heart of some of the most vulnerable areas of the world, and where people are really trying to just navigate the reality of life. And then you throw this very obviously globally important pandemic right in the middle of it, and things are just getting super out of control. You think of the caution that we're using here in the United States to isolate yourself as much as you can physically, to wear your face mask. That's just not realistic in some of the most vulnerable parts around the world. So did that, spent some time in Washington, D.C. for a member of Congress who specifically had an interest in foreign policy work and was on the Appropriations Committee. And at that time, when I worked for him, was on what's called the Subcommittee on State and Foreign Operations, which is basically the foreign policy subcommittee of the Appropriations Committee. And now I work for an organization called the U.S. Global Leadership Coalition, where I manage our operations across the western part of the country, and we talk about the importance of America's global leadership. And right now, we're talking about why that matters more than ever in the midst of a global pandemic. So thanks, Paul. Looking forward to the conversation.
Luke, we're excited to have you here tonight. You seem like you have just the experience that's needed for this conversation. So I'd like to preface some of these questions. I'm a pain management doctor, and I started my practice in Arizona about 13 years ago. And my first job was at Mayo Clinic here in Arizona, and I saw the way they practice, which just inspired me, and comprehensive integrated care. And when I started my own clinic with my best friend, Tori McJunkin, we said, even if we're the two least busy doctors in Phoenix, we're not gonna just put every patient on opioids, which was kind of the standard of care in 2007. And we started teaching about the dangers of opioids back in 2007. And specifically, some patients do need to be on opioid medications, but a lot of patients were on it just because we didn't really know what else to do for patients. And so from about 1997 to probably about 2014, we had this massive increase in opioid prescribing in the United States. And around 2014, some of the stuff that Tori and I were teaching, starting in 2007, the rest of the country really started to figure it out. The CDC started releasing monthly reports and educating doctors, and we started really getting it under control as physicians, actually maybe as early as 2010. But if you go back and look, what really happened during that time is, even as we were controlling the curve in the United States, we call it flattening the curve of the opioid epidemic in the United States, we didn't have a coordinated global response. And so right about the time where physicians were really changing their prescribing habits and being smart and talking to patients about coming off their opioids or reducing doses, we were writing naloxone, we were being more careful not to mix opioids with benzodiazepines, we actually saw death rates skyrocket from opioids. And it wasn't because of what was happening in the United States. It was actually because we did not have a global coordinated response. And around the world, they started making fentanyl in labs, specifically in China and Mexico. It was coming in through our borders. And so we actually saw death rates go from 30 or 40,000 a year to 72,000 deaths a year. And it was particularly because we didn't address it globally. So you and I think, agree on this, and we've talked about it. But as I started looking at the United States, we've done this multiple times. Like, we realized probably 30 years ago that we live in a global health ecosystem. And so these, whether it's tuberculosis or malaria or the opioid epidemic, it's not enough just to have a local a plan at home. We actually have to have a global response. I mentioned opioids, but just looking through the data today, the same thing happened with tuberculosis, for example. Tuberculosis, the work that we've done in the United States has, over a 15-year period, saved 48 million lives. 48 million lives. And by saving those lives in Africa and Asia and South America, we actually protect ourselves at home as well, because we decrease the overall tuberculosis burden worldwide. So I kind of talked a lot there, but that question I have for you, Luke, is this a consistent theme that you see with our work around the world, that the global health ecosystem is a real thing? Are you seeing that as well?
There's no doubt. There's no doubt. Look, let me give you one great example. In 2003, when we started really seeing the problem with HIV/AIDS around the world, and that this was becoming more and more and more problematic, and it was creating the conditions in which the American government said, okay, we are the leader, and we are going to do something about it. So President Bush in 2003, obviously George W. Bush, created what's called the President's Emergency Plan for AIDS Relief, more commonly known as PEPFAR. And this outstanding, one of the probably the greatest legacies of American foreign policy in the last few decades, is they went throughout the developing world, most predominantly in Africa, but not solely. And I'm sure you've probably seen some of this on your travels throughout Africa as well. And they said, look, we have the vaccine available, or the treatments available necessary to really deal with the HIV/AIDS epidemic as best we can, and we're going to do something about it. The United States has spent more money than any country ever has in the history of mankind, about $80 billion over the last 17 years to fight back against this issue. And we saved 18 million lives. 18 million lives.
18 million.
Investment. Exactly. It's amazing, Paul. Wow. And what we've done is by saying, look, we are the world leader. We're going to make an investment in the world. We've saved these lives. And what it shows the rest of the world is that America is the country that you want to call on in times of threat. We are going to lead us through difficult times, not just because it's the right thing to do, but because it's smart for us to do here at home. You know, we were talking about, as you and I were talking about just a few days ago, Dr. Lynch, about the kind of one of the hot topics we're seeing right now, of course, being the vaccine for the coronavirus. One thing we're realizing, and we need to continue to realize, and we'll talk about this more as we progress down this conversation, is that this is a global community. We have to recognize that it's not just the United States sitting around in science and labs working on this. And almost every nation around the world, they have scientists working to find this vaccine. There's this great alliance that U.S. is a part of, it's a multilateral institution called Gavi, which is the Vaccine Alliance. And over the last few years, they've saved over 13 million lives from finding vaccines, and I looked it up this morning. Over 760 million kids have received life-saving and vital vaccinations through multilateral organizations, and this is what we need to do.
It sounds to me like the United States has a history of
Absolutely.
being the leader on global health. Do you think that's an accurate statement?
Absolutely. You know, if you don't mind, I'm sorry, I'm going to jump into this quickly. I recently spoke with a friend of mine was formerly the ambassador of the Democratic Republic of the Congo, and actually also the ambassador of Malawi, where, as you mentioned, malaria was really, really problematic, right? And DRC, but also in Malawi as well. Malawi was hit equally, one of the worst countries in the whole world hit by the HIV/AIDS epidemic. But Malawi, of course, specifically hit there as well. And I asked him about the PEPFAR program, which I was just talking about, HIV/AIDS. And he said, Luke, it was a lifesaver. And then he stopped and he said, you know, that's too mild of a sentiment. Really, that completely changed the fundamental dynamics of the entirety of the continent. And it changed the world forever. And that was all done with a American flag on the side of the jacket and somebody coming in with a USAID on their shirt or State Department and showing that we're a leader in the world. And that means something. And we should be proud of that.
It makes me proud. I know you and I met, through my work in Africa, and we started talking, and you had worked in Africa, and we've been to some of the same places. You mentioned malaria. The research that I pulled this morning showed that the work that USAID has done in Africa over 15 years saved almost 7 million lives on malaria alone. And so just think about these numbers we've talked about. 48 million lives saved with tuberculosis, 7 million lives with malaria, 18 million lives saved through HIV/AIDS and what we did with PEPFAR through the Bush administration. This isn't a Republican or a Democrat issue. This is a United States issue that the rest of the world looks to us for leadership. And we have saved millions upon millions of lives through our altruistic work around the world. And that makes me proud. When I've gone to Rwanda, I've seen Americans in refugee camps through the American Refugee Committee. They go by a light now. We saw them at the conference last year that we attended in Washington, D.C. And when I went to Botswana, I saw the Peace Corps, which is also funded through our international affairs budget. And it makes me proud of the work we're doing. So the question I have is, which is actually my last question for you, with COVID-19, like we got an education the last 60 days, right? We got an education. When I went to New York City, my primary goal was just to help save lives and relieve some of my coworkers that were getting sick. But in the back of my mind, I thought, you know what, I'm going to learn some stuff that I can bring back to Arizona. And I think the same thing we could say about the United States. We got an education on COVID. What should we be doing now with that information to help the rest of the world?
Absolutely. Well, the first thing I would recommend all people do is to every week get on their Facebook and watch Dr. Lynch's videos. I think they're really helpful, and I've been watching them. So thank you again. Super grateful for your leadership during this time. But in all reality, let me give you a couple of just thoughts. The first being, we need to call this what it is. It's a global pandemic, and a global pandemic requires a global response.
Yeah.
Let me come back to that. The second thing I would say is do what you can to help. And I want to just talk about this locally because this is a global pandemic that has affected your life right at home. What happens globally matters here at home. Do what you can. I mean, Dr. Lynch, you were willing to fly to New York City. Not everybody has the skill set to be able to do that. But I actually brought my mask with me. I wanted to show you this. My Arizona Diamondbacks mask. Somebody made this and left it in. One of my neighbors here has one of those like they call them little free bookstores or whatever they're called, where it's like a bird feeder sitting outside their house. And somebody had dropped off a handful of masks, and you can tell that they were all handmade. And my recommendation to everybody on this call is do what you can to help.
We all have something we can give.
Absolutely, absolutely. But again, kind of in all reality, I'd love to just briefly tell you what's happening in the context of the most recent package that was passed through the House of Representatives. As we all probably saw, it's called the HEROES Act. It's about $3 trillion. Of that $3 trillion, there's no money appropriated to the international response to the coronavirus, which I think, right, you think about it from the perspective that this is a global pandemic, we need a global response. And we need to make sure that we're contacting our legislators, telling them that we understand that matters.
Well, it's interesting you say that. I'm the CEO of my practice. I'm a pain management doctor, here in Arizona. And when this hit, we were making massive changes, and I laid out, here's our plan to kind of survive. And we went overnight within like 3 days to 100% telehealth. And we made plans. It was the safest thing to do in the midst of all this. And this is before I went to New York. So this is probably 2 months ago now. And I made this whole plan. I laid it out and I showed it to my managers. And they said, basically, this is a pretty good plan, but you want us to go completely telehealth and you don't have any line item budget for phones. And so we kind of laughed that switching overnight to telehealth without phones is not going to work. That's kind of the analogy I thought of when I saw the budget with no response for the rest of the world is, we have a good package here that's going to help us. But if we don't look at what our leadership demands us to do in the world right now, it's going to come back around to hurt us. Like if you go back and look at the Spanish flu in 1918, a lot of people have heard this, but there was 3 waves, right? And so if you look at the data right now, we've certainly, we flattened the curve. We've started to lessen the curve. You can see cases going down now across the United States, even across the world. But this is the time now to be forward thinking. And I think what we do to help those in Mexico tomorrow, or India, or South America, or Brazil, by getting it under control there, we'll actually save lives here when it comes back around on the second wave. And so I think of that phone analogy of, I had a really good plan, but I didn't have one of the key components. And I think for us, a key component is how we get it in control in the rest of the world.
You know what, though? What I just heard you say is something that you probably wish you would have said in 2010 in the context of the opioid epidemic.
That's exactly right. And it didn't even cross my mind that we shouldn't only be fighting opioids at home, but we should be working with China and working with Mexico and working with Europe, that this was the opioid epidemic. If you really look at it, truly is a pandemic. It's not just an epidemic here, but it's an epidemic in multiple places around the world. And so is there anything else in your mind that we need to be doing today?
Sure. I just think that this is taking my international affairs hat off and just giving you, from my perspective, what I'm seeing. This is a difficult time for everybody in the world. We're grateful for the leadership that we have. Really great leaders doing a lot of good things, including yourself, Paul, and grateful for all of that. My recommendation to everybody is to take this seriously. Realize that as much as we are concerned at home, and the majority of what this government is, the United States government is doing, is focused on the domestic. It's the immediate response. It's making sure that you and I can put food on our tables. That's what this budget is. That's what the response is. Because what did we just see? 40 million Americans who have filed for unemployment. Isn't that what I think that's what I saw this morning?
Yeah.
So there is an immediate need here at home, but we cannot neglect the global response. It's not the United States' responsibility alone. Right. But if we want to be the leader, we need to be the leader. And it's necessary to keep us safe. If it's alive anywhere, COVID-19, it's going to make its way back here. So thank you for the opportunity to be with you today. Thank you for your leadership. I'm grateful to have a chance to talk to you.
Luke, it's so nice having you join us today, and I appreciate your leadership here in Arizona, around the country, and around the world for a long time now. Your service to our country means a lot to us. So God bless you. Thanks a lot.
God bless you too, my friend. Thank you. Have a good one. Bye-bye.
Wow. I mean, that was a wonderful conversation with Luke. I'm just really thankful that he joined us for our video this week. So many emotions and thoughts went through my mind as we were talking about Africa and malaria and the work that the United States has done. And honestly, it makes me so proud to be an American, that we have been doing this work for 50 years around the world, battling diseases like malaria and tuberculosis and HIV/AIDS, and just to hear the millions and millions of lives that we've saved. One of the thoughts that I thought about was the work that the American Refugee Committee has done throughout Africa. When I was in Rwanda a few years ago, I went and worked in a refugee camp on the border of the Congo, and there were 15,000 people in the refugee camp, and they were delivering babies every day, and they were taking care of the children and doing vaccination programs. And as I've thought about COVID-19 and how it ravaged through New York City, I've thought about what's going to happen when COVID makes its way to this refugee camp. They're living in tight quarters, and there's already issues with health, and I get very worried about that. And I just really pray, at this time, that the United States will continue our global leadership on this issue, and that we take what we've learned in the United States and we can help countries around the world. I know I talk a lot about God in these videos and praying for patience and for me. And my request to you tonight is, will you join me in praying for the rest of the world? The United States got hit really hard, but we also got a really good education on COVID over the last 2 months. And I think we can use that to help those around the world. But I think one thing we can all do is let's pray for people in Mexico and in Africa and India and Brazil and places that's hitting really hard right now. Let's just offer up our brothers and sisters around the world in prayer, tonight. Thank you guys so much for joining me. If you have any questions below, or if there's topics you want me to cover, please reach out to me. God bless you guys. God bless America, and God bless the rest of the world.